It's been 107 days since the UK entered into lockdown, and Dr Jenny Harries has been at the forefront of many government briefings to offer her advice, support and understanding of the pandemic.
So with restrictions still in place for many businesses and still no vaccine, where do we stand in the fight against COVID-19? And the Deputy Chief Medical Officer for England, Dr Jenny Harries, joins us now. And thank you for joining us this morning. So it's been 107 days since we went into lockdown. Where do you think we are now? What's the biggest thing that we've learnt in this time, do you think?
So I think we've all learnt to revalue our own lives and our health, actually, which is an important lesson probably for all of us in looking after ourselves. But in view of the pandemic, I think it's really important people understand this is still quite a long haul. The country has worked brilliantly to practice social distancing and get right on top of that peak. But we can't sort of become complacent because the virus is still out there. It's looking for more people to infect, and we need to stop it getting a grip. So brilliant work so far, I think, from the public. But the real important message is we have to keep practicing the lessons that we've learned around washing our hands, keeping our social interactions down, and really being careful, I think, when we're surfacing back into those normal things that we do normally, you know, going shopping, going to the pub, those sorts of things.
From a scientific point of view, this was something very new when you confronted it on our behalf when it first started. What have you learnt about the virus now that you didn't know at the beginning? Things like blood types. Does it affect people of different blood types?
So I think blood type, not specifically, I think what the general point is we're learning about the virus continuously, and that education is going to keep going over months, if not years ahead. When the virus first came to the UK, we'd learnt quite a lot, as much as we could, from international sources, so obviously particularly from China. And we knew, for example, that older people seemed to be more affected. But when you get the detail of the virus, it's only sometimes when you're looking in your own populations and in your own health services and looking at your own data, which you've got sort of much more detailed information about, that you really start to learn who is affected and who isn't. And in fact, the shielding guidance, for example, which has changed this week, there are some quite good news stories. So children, we know, the vast majority of children who we thought on a precautionary basis might be in the extremely vulnerable group, we know that actually most of those are not severely affected with illness. So there are some good news bits, but other things, so for example, obesity is actually problematic, and that's one of the things that we could do something about. So I think as we go forward, there are things that we need to be careful of. There are things we need to research more. One of those would be, you know, at which point in somebody's infection can you transmit the virus? That was an important learning point. And then what can we do about it, both individually and as a country?
I mean, the death toll obviously is decreasing, but there's still a threat of asymptomatic transmission. How much of a worry is that?
So asymptomatic transmission is really difficult to detect, and this is part of the problem. Obviously, if it's happening, our traditional ways of tracing disease are we go back to the case that we found, and you look past when they had symptoms and in an incubation period beforehand. And of course, if people don't remember that they felt ill, or they actually didn't feel ill, more importantly, it's very difficult to know who they could have transmitted to, because you tend to think back and think, actually, I felt rubbish on that particular day. Who did I pass it to? Who was I with? What happened? So it's much, much more difficult to trace back, and much more difficult to actually scientifically research as well. So this period, probably around 36 to 48 hours before symptoms develop, is quite an important one for managing this particular infection.
I found myself, I mean, obviously you look everywhere for advice, you listen to as many people as possible, but you have to be sensible and you have to keep yourself and others safe and all those sorts of things. But I find myself looking for good news. There is the eminent Italian surgeon who has said a number of times that he believes that it is weakening in strength. What do you say to that?
So there is a possibility that that is happening, but I think we don't have enough clear evidence of that at the moment. And I just say two things. It is possible that that will happen, but we should not be complacent. I think it's far too early to say that. And if people think that they might come into contact with this virus and therefore it's weaker and they shouldn't worry, that's not the right message to have at all. It will be good if in a few years we can look back and say, actually, this is not so much of a problem. But I do think we need to get used to the idea we're actually living with the virus. This is not something highly unlikely that we're going to just eliminate this virus. And so it's about what we do in the meantime while we're developing vaccines, while we're getting new treatments, which of course the UK has been a leader in. Dexamethasone is a really good news story, a cheap drug and proved to be effective from the research in this country. But no complacency, and that will be a good news story, but definitely not one yet.
It's difficult for people not to get complacent sometimes, I think, because, you know, we've been talking about this threat of a second spike, a second wave. We've seen illegal raves, large gatherings, protests happening over the last few weeks. That second spike is yet to happen, really. The death toll numbers are coming down. Do you think that makes people more complacent?
So I think it's very difficult and I don't want to label young people because that would be very unfair, but actually if you do not have friends who have become very ill, for example, it perhaps hasn't registered quite as much how dangerous this virus can be, and young people definitely are not as severely affected. But raves worry me as a public health doctor. That's exactly what we do not want to be happening. The death rate definitely is coming down, but effectively what we've seen is the first peak, and we want to prevent a second one. Because the weather is slightly with us, it's quite likely that the summer is sort of running a bit in our favour, that in the warmer weather, particularly when people are outdoors much more, which is much safer, we're unlikely to see one. But I think myself and colleagues are very, very concerned about looking for a potential second peak as we move into the autumn. And of course, that's the same time that we start having people presenting with other symptoms, which could confuse people. So flu symptoms, very obviously, and also when our hospitals get busier.
You mentioned the word vaccination, and so where are we with that? Because once again, you hear really good news, and then somebody tells us, well, there might never be one. So do you believe that there will be some sort of vaccine?
I'd be fairly confident there will be a vaccine, but I think people should not expect it next week or next month. There's some very good reasons for that. One is that actually we want to make sure the vaccine is safe for most people, despite what we're seeing and despite the death numbers. For most people in the population, you will not become severely ill with this. And so we have to make sure that if we're vaccinating people, we're not causing more harm rather than less. That's a really important point. We also still don't know very much about the immune response for this particular virus. It looks as though most people who are otherwise healthy will develop quite a reasonable immune response. We don't know how long that lasts, and that will also affect our understanding of how good a vaccine might be, how many doses you need of a vaccine, over what time period. So all of these issues are still to be sought out, and that takes a long time to get good evidence. So really good news, we've got human trials ongoing at the moment. So to start with, that's very much about safety. If I give this vaccine, is it safe for people? And then the much more detailed look at what it means in terms of immunity over many months. So it's very, very difficult to develop a vaccine, be absolutely sure it's safe, and to be absolutely sure it will work in the way you've designed it in a very short time period.
When are you thinking? Are you thinking
I'm thinking
Christmas?
I'm not thinking next month. I think there are more optimistic people around, so I'm trying not to be pessimistic, but I'm thinking sort of next year. And I think our biggest worry, and a big message probably to the public, is just to think about being really safe over the winter period. Yeah. So don't think we're going to have a vaccine around. Make yourself as fit as possible. Keep practicing that distancing over the winter.
At least there's going to be one. That's what we can hold on to. I just wanted to ask you, all the way through this, the government have sort of said that they have been led by the science, they've been guided by the science. Have your personal experience of that, did you find that to be the case?
I have always felt that I've been listened to very strongly, but I think what the public often don't appreciate is there is a scientific view. Science is not always black and white either. It's quite grey and edgy round the side. And then politicians, and it's their job, not mine, need to take that evidence and the science and manage it in a way which delivers for the population. And that is a balance of things. For example, if we take the issue of children in schools, I'm very comfortable about children going back to school. In my mind, as a public health doctor, it's so important that they are there and they're gaining their education, because that will set up their own life chances and their own health outcomes. But you can see even in that conversation, that is a balanced position, really, about how you're managing these sorts of things and what the long-term effects of guidance are. So that's a really positive one. But I'm glad it's the politicians have to make the final choices and not me.
Professor Sir Venki Ramakrishnan said the UK is way behind many other countries in using face coverings to stop the spread, and said not wearing a face covering should be considered antisocial.
Very different views on face coverings, and I'm aware of Venki's position, and there are a spectrum of views, I think, and obviously that view has contributed to SAGE discussions, and there are ongoing discussions about face coverings now. I think what we can say is if the evidence had been absolutely clear in one direction or another, different guidance would have come out, and it's evidence that is accumulating all of the time. It's really difficult to understand it because there is a balance between both the transmission of the disease, so how the virus kind of comes out of your body, your face and mouth, and lands elsewhere, but also what happens behaviourally. And we just don't have sufficient strength in the evidence, I think, to be absolutely clear one way or the other. I do think what has happened is, as we've learnt more about the transmission of the disease without symptoms, so this asymptomatic transmission early on, clearly people are looking in much more detail to say, well, if that is the case, is there anything we can do in the period before people are aware that they have disease, which would reduce that risk of transmission? And so I think generally there's a view moving towards that. But I think equally, I bet you'll get a lot of viewers ringing in or writing to you saying, and in fact, I'm one of them, I find if I can't see people's lips move, I have a slight hearing problem. So there are all sorts of issues about how this lands in the public. And what we do not want is, for example, stigmatisation around people who are not wearing face coverings. I think the advice at the moment is if you're in an enclosed space which has potentially poor ventilation, with people meeting lots of people that you don't normally meet with, and that's the transport scenario is the classic one where it's mandated, that's a good place to be wearing a face covering, potentially to prevent transmission over to other people. You're helping others by helping yourself.
One final question. More than any other virus in the planet's history, money has been thrown at this. More research, more great minds. It's been taken incredibly seriously. In the long term, with our understanding and knowledge of viruses, do you think we will be in a better place to prevent this from happening in the future, or at least to treat it faster?
I think what's happened with COVID, quite rightly, it's a pandemic. Professionals certainly recognise the importance of this, and we see it now. It's not just about health, it's about the economy, and that impacts people's health long term. And it's also about the fact realising that a disease which might be in one part of the country, of the universe, is our problem just as much as somebody else's. And I think that thinking started very clearly with Ebola in West Africa. We've seen other illnesses, so Zika, for example, which wasn't here but affected potential travellers. And what we're seeing now is an accumulation of that knowledge and understanding about infectious disease spread. That's a really important learning to take forward. And I think the work on the Joint Biosecurity Council Committee, for example, and getting all that information in one place will really stand us in good stead going forward.
Dr. Harries, thank you very much indeed.
Thank you.
Thank you, as always. Thank you.
Take care.